NHA Medical Assistant Review. Question 1. Which of the following choices would best answer the question, who owns a patient's X-rays? Option A, the patient. Option B, the doctor. Option C, the facility that performed the procedure. Option D, none of the above. The correct answer is option C, the facility that performed the procedure. The facility or provider that performs the imaging generally owns the physical X-ray record. The patient has rights to access or copies, but not ownership of the original record. Question 2. Which of the following reasons would be legal when considering a patient's medical record? Option A, allowing a patient's brother to view her chart to find out her birth date and address so that he can mail her a card. Option B, not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. Option C, not allowing a patient to view her chart because she is behind on her payments. Option D, all of the above are legal. The correct answer is option B, not allowing a patient to view her own chart because the physician feels this information would be detrimental to her well-being. Access to a medical record may be limited in specific situations if disclosure could seriously harm the patient. Payment status or a family member's request is not a valid reason to allow or deny access. Question 3. Choose the best answer to ensure adequate protection for legal issues. Offices should maintain patient charts for Option A, 10 years. Option B, forever. Option C, until the age of majority. Option D, 2 years after the patient was last seen in the office. The correct answer is option B, forever. Keeping records indefinitely offers the strongest legal protection because old claims or questions may arise years later. Many facilities follow state retention rules, but forever is the most protective option listed. Question 4. The term efferent means Option A, carrying an impulse to the brain. Option B, carrying an impulse away from the brain. Option C, carrying impulses to the motor neurons of the appendicular muscles. Option D, none of the above. The correct answer is option A, carrying an impulse to the brain. Afferent nerves carry impulses toward the central nervous system, commonly described as toward the brain or spinal cord. Efferent pathways carry impulses away from the CNS. Question 5. The medical term basophilia refers to Option A, an attachment of the epithelial cells of the skin to a basement membrane. Option B, an overabundance of a particular white blood cell in the peripheral blood. Option C, an underrepresentation of basophils on a blood smear. Option D, none of the above. The correct answer is option B, an overabundance of a particular white blood cell in the peripheral blood. Basophilia means an increased number of basophils, a type of white blood cell, in peripheral blood. It does not refer to epithelial attachment or a deficiency. Question 6. When considering the structural organization of the human body, which of the following is the basic unit of life? Option A, chemicals. Option B, atoms. Option C, molecules. Option D, cells. The correct answer is option D, cells. Cells are the basic structural and functional units of life. Atoms and molecules are smaller chemical components, but they are not independently living units. Question 7. When a patient is standing in anatomical position, where are his feet? Option A, facing forward with the toes spread open. Option B, facing out to the sides to open the hips. Option C, side by side and facing forward, toes resting comfortably. Option D, the feet are pointed inward. The correct answer is option C, side by side and facing forward, toes resting comfortably. In anatomical position, the body stands upright with feet side by side and facing forward. This standard position is used as the reference point for directional terms. Question 8. A physician asks you to place the patient with his dorsal side facing the exam table. Which of the following accurately describes how the patient is positioned? Option A, the patient is lying prone. Option B, the patient is lying supine. Option C, the patient is lying in the recovery position. Option D, the patient is lying on his stomach. The correct answer is option B, the patient is lying supine. If the dorsal side, or back, is facing the exam table, the patient is lying on the back. That position is called supine. Question 9. The body plane that divides the body into right and left sides is the Option A, frontal plane. Option B, medial plane. Option C, median plane. Option D, transverse plane. The correct answer is option C, median plane. The median plane divides the body into right and left portions. The frontal plane divides anterior and posterior portions, and the transverse plane divides upper and lower portions. Question 10. A patient is asked to abduct her arms. Which of the following accurately describes her arm movement? Option A, she moves her arms away from her trunk. Option B, she moves her arms toward her trunk. Option C, she rotates her arms at the wrists while holding them toward her feet. Option D, she crosses her arms over her abdomen. The correct answer is option A. She moves her arms away from her trunk. Abduction means moving a body part away from the midline of the body. Moving the arms toward the trunk would be adduction. Question 11. Which of the following sets of word parts means pain? Option A, dynia and algia. Option B, hay and an. Option C, ia and a. Option D, pathy and ossus. The correct answer is option A, dynia and algia. The suffixes algia and dynia both mean pain. Other listed word parts refer to absence, condition, disease, or abnormal state rather than pain. Question 12. A common childhood illness is caused by the Bordetella pertussis bacterium. Which of the following diseases is caused by this bacteria? Option A, German measles. Option B, RSV. Option C, meningitis. Option D, whooping cough. The correct answer is option D, whooping cough. Bordetella pertussis causes pertussis, commonly called whooping cough. It is a contagious respiratory disease seen especially in children without adequate immunization. Question 13. Which of the following glands found in the skin secretes a liquid called sebum? Option A, apocrine glands. Option B, sebaceous glands. Option C, lacrimal glands. Option D, sweat glands. The correct answer is option B, sebaceous glands. Sebaceous glands secrete sebum, an oily substance that lubricates skin and hair. Sweat glands secrete perspiration, and lacrimal glands produce tears. Question 14. A patient that has been diagnosed with alopecia would be described as having: Option A, body lice. Option B, lack of earwax. Option C, indigestion. Option D, hair loss. The correct answer is option D, hair loss. Alopecia means hair loss. It may involve partial or complete loss of hair from areas where it normally grows. Question 15. Which of the following anticoagulants would be found in a light blue vacutainer tube? Option A, EDTA. Option B, sodium oxalate. Option C, lithium heparin. Option D, sodium citrate. The correct answer is option D, sodium citrate. Light blue top tubes contain sodium citrate, which is used for coagulation studies. The additive binds calcium while preserving clotting factors for testing. Question 16. A medical assistant is asked to draw blood in the antecubital, AC, space. Which of the following veins are found in the AC space? Option A, cephalic. Option B, median cubital. Option C, basilic. Option D, all of the above. The correct answer is option D, all of the above. The antecubital area contains the median cubital, cephalic, and basilic veins. These are common venipuncture sites, with the median cubital often preferred. Question 17. A patient's urine specimen tested positive for bilirubin. Which of the following is most true? Option A. The patient should be evaluated for kidney disease. Option B. The specimen was probably left at room temperature for more than 2 hours. Option C. The specimen is positive for bacteria. Option D. The specimen should be stored in an area protected from light. The correct answer is option D. The specimen should be stored in an area protected from light. Bilirubin is light sensitive and can break down when exposed to light. Protecting the urine specimen from light helps preserve the accuracy of the result. Question 18. Which vacutainer tubes should be used when a requisition calls for blood to be drawn for an HNH and glucose test? Option A, 1 light blue, 1 red. Option B, 2 lavenders. Option C, 1 lavender, 1 gray. Option D, 1 green, 1 red. The correct answer is option C, 1 lavender, 1 gray. HNH testing is performed on an EDTA specimen, commonly collected in a lavender tube, while glucose is commonly collected in a gray tube. The gray tube additive helps preserve glucose levels. Question 19. Specific gravity in urinalysis. Option A, compares the concentration of urine to that of distilled water. Option B, is useless when the patient is dehydrated. Option C, can only be done with a refractometer. Option D, none of the above. The correct answer is option A, compares the concentration of urine to that of distilled water. Urine-specific gravity compares urine concentration with the concentration of distilled water. It helps evaluate hydration status and kidney concentrating ability. Question 20. When placing a patient in the AP position for an X-ray, what position would the patient be in? Option A, facing the film. Option B, right side against the film. Option C, left side against the film. Option D, facing away from the film. The correct answer is option D, facing away from the film. In an AP X-ray projection, the beam travels from anterior to posterior, so the patient's front faces the X-ray source and the back is toward the film. This is best described here as facing away from the film.